independent reporter and attorney Aaron Parnas, and he is joined by a who's who of senators and Congress people. We have Minnesota Senator Tina Smith, Congressman Mike Levin from California's 49th District, Representative Yasmin Ansari from Arizona's 3rd District, of course, yes, and Aaron Parnas, my friend, and the owner of my fantasy football league, which I am now tied for 2nd place. And thank you very much to my victory over Olivia Giuliana last night. I think we're missing Senator Smith at the moment, but welcome to everybody. And thank you all so much for being here. It is incredibly important. Thank you very much for joining us.
Thanks, Jojo. Great to be here with you, both Congresswoman Ansari and Congressman Levin. I want to jump right in because I think a lot of people are obviously concerned around the country over what's happening, especially with the government shutdown now, 11 hours away. I want to start with you, Congresswoman. What's your message to Arizonans who may potentially be furloughed at midnight tonight?
Unfortunately, every single Arizona Republican member of Congress betrayed their constituents when they first voted for the big ugly bill. They've betrayed their constituents now by not being here. We have a couple of members of our delegation too busy running for governor, quite frankly, to focus on the people that they currently serve. Andy Biggs is running for governor. David Schweiker just announced today he's running for governor. And it is constituents in their districts, tens of thousands of them, who are going to see their healthcare premiums go up, who are going to potentially lose Medicaid, who are going to struggle with family members or kids who have autism or disabilities. And I have heard from my constituents who do work for the federal government, quite frankly, that they have asked us to do this and to let Republicans shut the government down because they refuse to protect healthcare for people. They want to see Republicans own the shutdown because this is entirely their fault. And we will be doing everything that we can to support them during this very difficult time. We're planning engagements in the district to see how our office can be most supportive during what will be a very rough period for government workers who don't deserve this. And this is on Donald Trump.
Well, you mentioned the Affordable Care Act, the healthcare subsidies, the premiums going up. And Congressman Levin, I want to ask you, because it's a very complicated subject. When you say Affordable Care Act premiums or Affordable Care Act subsidies, sometimes people don't really know what that even means. Could you really describe what will happen at midnight tonight if those aren't extended?
Sure, Aaron. Well, back during the COVID years, we put in place, as part of the American Rescue Plan, if you remember the American Rescue Plan, a tax credit to lower the out-of-pocket costs for people who are on the Affordable Care Act. And the basic idea there is we want as many people to sign up under the ACA as possible. It was an extremely successful program. It led to millions and millions more people signing up under the ACA. And then we extended that again during the Inflation Reduction Act. And because we used the budget process, the reconciliation, not to go too deep in the weeds, we weren't able to permanently extend those tax credits. I think we would have loved to do that if we could have, but the budget process said there had to be an end date. That's how we were able to do that back with the IRA. So that end date is coming at the end of the year. And what's happening, what I'm seeing in my community and what I'm hearing in communities all across the country is people are starting to get the notices. They're starting to get the news about just how big of a spike they can expect next year in their premiums. And the estimates are that around 5 million Americans across the country are going to see those new costs and just say they can't afford it. They simply cannot afford to be on an ACA plan, and they will go without insurance. Millions and millions of others will see those new premium spikes and will just pay more for their insurance. They'll have to make really tough decisions around groceries or health insurance, decisions that we should not want any American to have to make. And in California alone, 660,000 people are expected to lose their health care under Covered California. So this is a huge crisis. It is an entirely self-inflicted wound by the Republicans. They had the opportunity to extend these credits as part of their big ugly bill this past summer, and they chose not to. And if you look at the other argument I hear is, well, how much does that cost to do it? In the grand scheme of things, the costs are far higher of not doing this because the average American is going to have higher health insurance costs as a result. It's not just about those folks on the ACA. It's about all of us that are going to have to bear the expense to the healthcare system. And ultimately, that's what we have to remember next year during the discussions around Medicaid. Is it's not just if you're on the ACA. It's not just if you're a Medicaid recipient. It's not if you're on Medicare. We know Medicare is going to run into trouble as well. Every single person in the United States, if you get your health care through private insurance, through employer-sponsored insurance, everyone's costs are going to go up. Everyone will feel the impact of this. This is a crisis. This is something that we need to address right now. And the fact that Republicans aren't even here, they're off doing whatever the hell they're doing right now instead of being here to at least negotiate with us in good faith, that is inexcusable.
Well, I think my follow-up question to that point, Congresswoman, is Republicans aren't on the Hill right now. So any deal that you all negotiate, I mean, the odds that you vote on it before midnight tonight, probably slim to none since Republicans are really all around the country. I mean, is there any stopping a possible shutdown at this point?
I mean, look, Donald Trump could choose to stop a shutdown if he really wanted to. The Senate will be voting today. As I'm newish here, but I have seen in these first 9 months that the Republicans operate like they are in a cult. And if Donald Trump says do something, they will do it. And so if Donald Trump was to instruct the Senate Majority Leader to compromise and restore the healthcare cuts, cancel the cuts, lower the cost of healthcare, save healthcare, as Representative Levin so articulately just described, then I'm sure that they would do so. I'm very sure of that. So it is at this point up to the President of the United States whether or not he wants to shut the government down, whether or not he wants to take any accountability in fixing the healthcare crisis that he created. That would be the saving grace at this point.
Well, Congressman Levin, what's your response to Republicans who say, well, Democrats, you all just voted for this clean CR back in March. Why not just do it again?
Well, first of all, a lot has happened between March and now. And as an appropriator, I've seen as this administration has completely steamrolled the Congress of the United States as it pertains to power of the purse. And that's a whole nother set of issues I don't even need to get into. But what has also happened is that they have offered no solution on this ACA premium issue. And we have seen in the summer their big ugly bill, now the big ugly law, and we've seen the impact that that will have on the Affordable Care Act. So that is a huge difference. We could hear what they wanted to do back in March with regard to healthcare, but now that they've actually done it, and now that we see the harm that will be inflicted on the American people as a result, again, it is not unreasonable, Aaron, for us to want to protect the healthcare for millions and millions of Americans. I don't understand how any Republican representative can go back into their districts, back into their communities, or how they can be there right now, look their constituents in the face, knowing full well that in every single congressional district in America, tens of thousands of people are going to be at risk of losing their health insurance because of what they're doing. In some cases, higher numbers than that. And with a straight face, try to say that somehow, it's not their fault. Somehow this is the Democrats not going along with the plan. Well, you're damn right we're not going to go along with the plan. We're talking about millions of Americans who are about to lose their health care. This is a disgrace, Aaron, an absolute disgrace. We're not going to stand for it.
Well, I tend to agree. And Congresswoman, I do want to touch on one subject that a lot of people are fearful of, and that's mass firings. Obviously, Russ Vought sent you all a memo saying that essentially tomorrow they're going to start firing employees in agencies where money is not essentially appropriated. Are you worried at all that the administration can conduct a mass downsizing, tens of thousands of jobs, not just furloughed, but actually lost as a result of a government shutdown?
I mean, look, I'm certainly worried, but this is also nothing new. This administration has been operating like a rogue authoritarian regime since day one. The some of the very first actions I was taking in January and February was showing up to the EPA, to the Consumer Financial Protection Bureau, to HUD, to all of these departments that back in the Elon Musk days, in the Doge days, were being gutted illegally. And we were fighting back against that. We also know that there are reports of mass amounts of federal employees who intend to quit and leave the job because they have been intimidated, they have been harassed, they have been stripped of any dignity in these roles. The entire thing is concerning. That's why we've been warning about Project 2025 since last year, since the elections. And they are very much underway in terms of implementing Project 2025. Now, I don't think that these continued threats from the administration should scare us into backing down or scare us into not fighting for healthcare for our constituents, because at the end of the day, that is like, I have constituents who are going to go homeless, who are going to potentially be in significant medical debt, who could die as a result of the healthcare cuts that are looming before us because of the Republicans. So that's the number one priority for me. We will do everything we can to fight back and protect the federal employees. I want to give them massive kudos because they have been heroes in all of this. And those who were not fired up until this point have been working under horrific circumstances and really doing heroic work for our country.
And I will just add just quickly that I think that the courts have struck down a number of the mass firings already. And I'm pretty sure it's going to happen again if they are fired in the next coming days. Now, Congressman Levin, final question to you. Obviously, Republicans are not on Capitol Hill, but their staff is right now. What do you recommend to folks watching this and around the country? Do you recommend calling their offices? How can they get their message across in this moment?
Well, all of the above, whatever direct actions people can take across the country, I strongly encourage that. To your point very quickly about Russ Vought. So you said at the end the important part. What he is doing is illegal and unconstitutional. It violates everything from the Impoundment Control Act, the Anti-Deficiency Act, all the civil service laws. My whole thing here would be taxpayers will bear the expense because the federal government is going to have to hire all these people back with back pay. So this is all really the actions of a partisan hack who doesn't understand or doesn't believe the fundamentals of 200 years of constitutional precedent, and we're all going to suffer the consequence. And he's been empowered by this president in a manner unprecedented for a budget director. We've simply never seen anything like what Russ Vought is trying to do. And he is going to try to use a shutdown to try to fire as many people as he can. But even this crazy Supreme Court, I think, is going to find it illegal and unconstitutional. The question is, are they going to allow a lot of the damage to happen in the interim, as they are doing with the $4 billion in spending that they are allowing to be frozen for now? I'm confident that in the long run, a lot of what the administration is doing will be deemed unconstitutional and illegal, whether it's the emergency powers under IEPA for the tariffs, whether it's the Impoundment Control Act, whether it's Birthright Citizenship, Alien Enemies Act. But the question that I want to know, and I want to know why this is allowed to continue, in the interim, the damage being done is so great that it provides an incentive for the Russ Voughts and the Stephen Millers and all these people to continue to do what they do, knowing full well it's illegal, stretching the system as far as they can. It's truly unconscionable what they're doing right now. And I hope don't just call and complain about that. You got lots of things to complain about.
Well, you heard it here first, Congressman, Congresswoman. Thank you so much for joining me.
Thanks, Aaron.
Thank you so much.
Thank you so much, Aaron, Congressman and Congresswoman.